Today is Wednesday, June 9th, 2021, and we'd like to welcome everyone to the board workshop. We'll call this meeting to order at 8:31 a.m. You can join today's board workshop via phone, dial 971-254-3149, conference ID 736-023-979. Audio capabilities are listen only and are offered on a best effort for the public. Before we get started, I'd like to remind everyone to mute your phones. You can do this by pressing *6. Please unmute yourself when your agenda item is ready to be discussed. All others must remain muted. Thank you. Public comment. The board will allow public comment at workshop and board meetings during a public comment period. Those intending to provide public comment for the workshop or board meeting shall email submissions to publiccomments@co.tillamook.or.us. Public comments received by 5 p.m. on Tuesday will be distributed to the board and become part of the meeting public record. You may also mail your public comments to the Board of Commissioners Office, 201 Laurel Avenue, Tillamook, Oregon, 97141. Public comments submitted via email after the deadline or during the workshop or board meeting will be presented by staff to the board during the public comment period. Unless otherwise specified, these submissions will be presented during the board meeting. Well, again, I welcome you all, and I'll ask if there's any public comment at this time. There is not. We do have a non-agenda item this morning, and that is discussion concerning unrolling the COVID-19 orders. So we just wanted to start the conversation because the governor's office has indicated that the state of Oregon may reach 70% vaccination rate by they're projecting June 21. And thereafter, the plan from the governor's office is that the COVID restrictions would roll back. So the risk level criteria would go away and the OHA guidelines would change accordingly, and thereafter also the OSHA guidelines would change to align with the OHA guidelines. So we just want to be ready when all of this happens. We don't know and can't know exactly what day we'll hit 70%, but they're confident that it'll be in June. And it could be sooner rather than later. I think we're at, what was it yesterday, 66.8%?
That was the last number I heard. I'm sure Marlene will have an update or Ed for us this morning.
Yeah, so it's close for sure. And we need to have some, to have an idea about how we want to do this. If we want to, who we want to bring back to work, what the implications are, if we want to open up the courthouse, if we'll know more about when OHA releases their guidelines. We'll know about whether or not we still need to wear masks and have social distancing. There's the assumption that we will not. That OSHA, I heard last week from the governor's office that OSHA will align their rule. They currently have a permanent rule for mask wearing and social distancing, but I heard for the first time last week from the governor's office that rule is tied to OSHA, or OHA rather, and so when OHA changes their guidelines, OSHA will follow suit. So it's possible that all of this will be unrolled in the next week or two, and we just should have some idea of how we want to respond. I think it's, I'm just going to open the floor.
Yeah, I think it's really important that we've talked about it, because I think that on the day it happens, the expectation of all people will be they can start burning their masks. And I think, as we saw with the CDC guidelines, when that came out, it created confusion. People didn't know what applied to us. So I think first and foremost, it's just being super clear that we are governed by OHA and OSHA, and that we will not be able to make changes in our workplace world until those two agencies make their changes and make them applicable to us. Because I can foresee a potential for more chaos if the governor comes out and says it's 70% today, and OHA and OSHA have not yet had time to roll that through their process, because I feel that's kind of like what happened with the CDC guidelines, right? Came out and said, here's the new thing, but it hadn't had time to roll through all of the infrastructure, and it created big chaos for everybody. So I think the awareness for all of us that we gotta wait for all the steps to follow is really important. So that's first and foremost on my mind. I think after that, the question really would be partly in conversation with department heads about how we bring people back from this. I don't, each department has sort of had a different process and a different set of difficulties, right? And I think department heads we need to have that conversation and have them figure out maybe a plan for us that says, here's how I would recommend reopening my department. Because it may, just as it was different to move people to work at home department by department, it's probably going to be different to roll people back in department by department. I will be curious to hear from public health as to what their suggestions and recommendations may be, so that we are looking at an informed decision through public health as well. So those are my thoughts off the top of my head. It's just, I'm thinking process as much as anything.
Thank you.
So I'll take a little different tact on this.
Yeah.
I think when the governor, and I honestly feel that it will happen this month,
Mm-hmm.
When the governor decides that we meet that 70%, she has already said that OSHA and OHA rules will be rolled back. We will still follow the federal guidelines when it comes to having to wear masks on public transportation, in airports, hospitals, things of that nature, I think would remain. But the timing is going to be something, because we will have to, even though the governor makes a decision, unless she announces that OHA and OSHA are already on board, that's going to be a difficult, but it should be soon after any announcement, and we hope. I have had conversations with several department heads, and so far to a person, they are telling me that it's time for their employees to come back to work in the courthouse. So I know there may be some consternation. I think, and Bill, I'm not sure exactly how the unions might be involved in this discussion. I'm not sure they could be.
I don't think so, David. It seems to me that, if you guys say come back to work,
Okay.
we'd have to ask Stephen for
Yeah.
more help, but it seems to me we should be able to say it's time to come back to work.
And again, at that point in time, I think we would just open the courthouse again, as it was before March of 2020. I like the idea, however, of having the increased security that we have and keeping public access to a single door to the south with the metal detector in use. A sheriff's deputy to handle circuit court, of course, as always, and perhaps continuing on with private security, just to monitor the doors, etc. I think could be good. So yeah, it's going to be an interesting reopening scenario, and I think I would have to agree with Commissioner Scar. It may not happen overnight. There may be some tinkering that we're going to need to do, but especially when it comes to our employees. I mean, I understand there are many things that can occur when you're working remotely, especially if you've got childcare issues and things of that nature. But we all need to remember that our number one job is to serve the public, and we best do that when we are in our workplace. So, again, they're going to be interesting conversations, no doubt.
Do we have any directors or leaders on the phone who'd like to talk about this issue?
Good morning. I'm sorry but I wanted to talk about this.
Hi, good morning,
Good morning,
Marlene.
Marlene.
Good morning. I was trying to look at updated guidance from OHA last night around what's going to happen when restrictions are lifted, or what might those changes be for the rest of the state. So I don't have all the detail, but as Commissioner Scar was indicating, And I think you were referencing also, Commissioner Yamamoto, that there will be lifting of those restrictions with the exception of, and maybe you'd remember it better than me, I'm trying to remember, transit, healthcare, I don't remember what the third one is,
I
it's
think
on my
there's
report.
Senior
But,
living, yeah,
that-
senior and congregate living, I think, include mass still, hospitals.
But that includes removing the restrictions as indicated for social distancing and masks, and not having to show proof of vaccination status, at least in the last one that I read. So it will impact on the state of Oregon and those coming in. For employees, you know, I think you've already talked about it may have an impact by department based on county policy, just of how you include people coming back in or what the considerations were before. I know even with healthcare, to maintain social distancing in some instances with limited space, we've had some folks work from home in order to continue operations, and moving some of those people back means you gotta rearrange your space. So I'm not talking about it so much from a public health perspective as I am just as a manager trying to get people back to the office. So we're trying to make accommodations for space. As you are mentioned, childcare that seems to be extremely tight right now. Also, our schedules we have changed to 8 to 5. So we're gonna go back to our other schedule, but not for several months, to allow staff to adjust and give them notice of the schedule change per union contract. So I'm just mentioning those things because those are the items that we're considering for the health department, health center staff. And then from the public health perspective overall, I will be reviewing the updated guidance from OSHA and OHA, which you'll probably receive almost simultaneously to when I receive it. So I'll try to look at it real carefully, and maybe we want to just have a separate discussion about the interpretation of those if there's any gray areas with legal and with HR, if you think that's appropriate.
I do think that's appropriate, thank you. Hey, I have a question. The part of the reason that we have some people working from home is that if, in the event that somebody gets the virus and then the whole department has to quarantine, will that practice continue when all of the restrictions are lifted? If somebody gets a virus in the office, will the public health department still be investigating that and doing contact tracing, and will those departments still have to quarantine?
There's a change in the guidance around quarantine also for vaccinated people. And I can make sure if our HR department doesn't have it, or you don't, to include that and provide an update. So it won't be the same, although public health will still be investigating, just to make sure we're keeping track of those. And if it's what they call a breakthrough case, so someone who's been vaccinated and still gets sick. So it will be different in terms of the response in the department. You shouldn't have to shut everything down, especially if you have people that are vaccinated. For unvaccinated people, there may be some additional guidance. We're still encouraging people to continue to self-monitor like you would anytime. If you're sick, don't go to work. We don't want the rest of your department or your team sick, but continue to monitor for those symptoms and determine, call your manager and then talk with your healthcare provider about symptoms to see if you should be going into work if you're not vaccinated and worried about COVID. We still can do testing, no cost, get you in the same day, and help address some of those questions real quickly. So I will just put a follow-up note here around the modified guidance for quarantine to make sure all of you have it and HR and legal have it if they don't already.
Thank you.
Yeah, and that becomes important if we are not checking vaccine status, which I don't think anybody wants to do, but recognizing that if you do have an entire department that is not vaccinated, we could be looking at a scenario where a department is just all out for 2 weeks. I think that's a great question, Commissioner Bell. Thank you for bringing that up. And Marlene, thank you for bringing up, your department is going to have a very different look because you are healthcare workers and because masks continue to be required for healthcare workers, that's, at least in the guidance as we've seen it from CDC, that is going to impact your department very differently than other departments that don't provide that. So I do think, as we talk about unrolling, that department by department piece becomes important when we recognize that there are some that fall differently into CDC guidance than others.
Very true.
Yeah,
So
nothing
you
is
won't
simple.
see any people over there with a mask on or any, it appears. So and again, if you're not asking, then you won't know. So you may see some people with masks that choose to keep wearing them. And again, that'll be kind of an interpretation for HR and legal about, how we address that.
So one thing that occurs to me is that in this process, we've learned a lot of things that we can do that we didn't know we could do pre-COVID. And some of them are valuable lessons. And so I think that each of us should get together with the departments to which we're liaison and talk about, does every position in your department need to come back in person immediately? Because I think we've learned, I've heard from people that some positions are entirely effective working remotely, some not at all. Some have public-facing interactions and need to be on site, some maybe not so much. So I think it's worth talking to leaders because you'll know that about your department and, in a way that we won't. So I think that each of us should talk to the departments to which we're liaison and figure out what would be the ideal scenario moving forward, because we don't necessarily just have to snap back to everything exactly the way it was before if we've learned some things during this time that are working well.
So I do feel there are certain efficiencies that we have by being together in offices, especially in departments that have new personnel. The way that new personnel learn how departments work and what responsibilities are is by interacting with their peers on a regular basis. And if we have departments that some people are allowed to stay at home and some people are going to be at work and we've got new people in the middle somewhere, I just think having that eye-to-eye contact with your peers on a daily basis really does add a lot. So I think we need to be careful and if we're going to allow certain people to remain at home, there has to be a really good reason. When they were hired, this was a situation where they were hired to be here in the courthouse or in their workplace on a regular basis. So I think it's something that we're going to have to take a very, very hard look at if we're going to offer options to that.
And we'll have to involve HR, of course. Okay, I see Gordon has his hand up.
Yes, good morning. I just thought it'd be worth reemphasizing that based on conversations I've had every time we have had changes in the past, that it's not going to be a flip of the switch, that whenever the guidance or whenever she says that everything is released, it's not going to be, if the information comes out at 1, that doesn't mean at 1:01 everything changes. People need to be patient, and just like any business, once the guidance comes out, every business is free to do the change any manner that they see fit. It's not, some businesses may say, I prefer to have everybody still be masked, and that's fine, what they choose to do. So the thing that struck me, I heard a while back, was as confusing as it was when we came into COVID, it'll be just as confusing coming out. So I just reemphasize, everybody, please be patient. And when you hear that it's okay, that doesn't mean it's okay in your particular area. It's going to take time for it to filter from the governor's office through Oregon Health Authority, through OSHA, down to the county, down to the person level. So again, just be patient.
Thank you, Gordon. Jerry has her hand up.
Good morning, Jerry Godber, Director of the Toledo County Library. I had anticipated that the library would come back in a sort of phased manner in terms of when we get the word, we are able to bring furniture back, so patrons can come in and work on, use our Wi-Fi, read the newspapers, things of that nature, but not have programs until later in the year. And partly it is because library programs take some time to plan, so also plan and promote. But be very curious to I have staff asking about not wearing masks in staff areas. So, just kind of throwing that in there, that I obviously will have a conversation with my board liaison about bringing back in certain services with the library. And then when the time comes, when we have some positions filled, we can expand hours, which I would then come to the board of commissioners. So just throwing out my 2 cents.
Thank you, Jerry.
Can I comment quickly? So I think the library is one of those other places that we're looking at sort of an interesting unrolling, because children are one of the big users of our library, and children cannot be vaccinated. And so what are our extra precautions potentially that we feel and maybe legally need to take to create a safe environment in that children's room, knowing that at this point 11 and under cannot be vaccinated? So I think about cleaning, all the things we've learned about how we keep COVID from spreading in groups. Which of those do we need to continue? And maybe not only in the library, but everywhere, because we have to know that we will have unvaccinated patrons that are coming to the library and to the clerk's office and to any of our public-facing spaces. And so what responsibility and liability do we have if they come in, and theoretically pick up COVID and go back and become super ill? So I think there is still a public health portion of this, and I assume that OHA will probably address that, as perhaps will OSHA. But I think there is still that piece. Those who have chosen to get vaccinated have a safety factor, but those who have chosen not to are still at risk. And how much liability and responsibility do we have to create environments that are safe for them, given that some of them cannot get vaccinated, as opposed to have chosen not and feel that it's, that they're okay and they're safe based on their own personal choice, which they should have. But we have some who don't have that choice, and children come to mind right off the bat, just from talking with friends of mine who have little ones, who are trying to figure out how to do their life with unvaccinated little ones, knowing that COVID is still out there. So, complex.
And it is complex, but one thing that this county cannot do, and I don't think any county can do, we cannot be responsible for everyone's personal choices. Even though I understand that vaccines are currently not available for children under the age of 12, or under the age of 13 actually. So we cannot be we can't be responsible for protecting everyone from everything. It's like a flu shot. You can certainly, you're on your own, but it's not the county's responsibility to make sure that we don't have areas where you cannot catch the flu. I mean, this just gets very, very difficult, and we can't be the nanny state for everyone. There are personal choices involved. Again, I understand children are a special issue here. And again, I'm hoping that the federal government will come up with guidance on that. But we have to be very careful in trying to protect everyone from everything. That is not our ultimate responsibility.
Yes, and I think the challenge, I know early on the legislature was not willing to put anything in place that sort of protected businesses and government from being sued for lawsuits around COVID, and I don't think that ever resolved. I think it's remained out there with an unknown, and I look at our legal counsel, I think it's remained as an unknown as to how much liability, may ultimately fall from somebody getting COVID in a county setting. And sort of the thought was, well, as long as you're following all the guidance, you should be okay, right? It's just make sure you're following the guidance. And curious, as the guidance unrolls, does that then sort of remove that liability or move that liability conversation in a different direction.
Yeah, it certainly does that, but for sure the lawsuits are gonna roll out just like everything else.
Yeah.
They've been waiting, I think,
Yeah.
to do those sorts of things.
Right.
Commissioner Shaw.
Yeah, I think I would encourage us to continue some of the cleaning protocols and pieces perhaps, just because it's the right thing to do, particularly in the children's library room above all, because we know that, I know my daughter she loves the library, and when she was little, we spent hours in there, and, just for our own, just doing the right thing in the community, maintaining some of those extra cleaning protocols and things, even if not required. So
Yeah.
I put that out there for Jerry to chew on, and I know she's thinking, I'm sure, about that opening and how to do it safely, so,
Yeah.
as she indicated.
Well,
So Bill, I'm glad to be back.
I was here in March.
That's right, yeah. That's
So
right.
this is not.
Yeah, definitely.
No better
I
man
understand
for the
like
job. You wound it up, now you can help us
that.
unwind.
I like that.
okay. Well, I urge everyone to remember that the virus is still moving around in the community. And so I sense that in most people, including me, there's the desire to take off the damn mask and hug my friends. And, but in fact, the virus is still moving around in the community. And we also have to consider the variants. The variants are also moving around in the country, and I don't know yet, maybe Marlene can tell us later, I don't know yet how many variants we've identified in Tillamook County, but the point is that when we hit the 70%, that won't mean we're entirely safe. So I wonder if Under Sheriff Kelly or Lieutenant Seaholm want to speak to this at all. Do you want to speak to this subject?
Briefly, sheriff's office is a little different. I mean, we've been having to be full staff in an office pretty much since March. So, one thing I just like to commission, I think, the county is in the business of community customer service stuff, and we have done. I've been really impressed the way the county has been able to provide service during this year, 14 months or something like that. But it hasn't been perfect. It's delayed because people aren't in offices. So we can get it done, but it just takes a little bit longer. And I know I can't totally speak for the sheriff, but we want to get back to a little bit more of how we did things because it slows down and we're backlogged in concealed weapon permits and certain things like that we just can't do. But ultimately, we got to go back to what we're supposed to be doing and efficiently for our bosses.
Thank you.
But it is a complex thing. There are a lot of things we gotta still watch out for. That's kind of what we deal with. And we have to do our job, to look out for the risks and things like that. It's just that's
Thank you. I appreciate it.
Yeah.
Okay, do we have anything else on the subject?
So it sounds like we're each gonna speak with our liaisons, and sort of ask those departments to begin to create some form of at least a thought process, if not planning for when they say masks may be removed, how does that impact their staff and their department? Correct?
Yes.
Perfect.
Yes.
And in the meantime, if it happens before we all meet again and have the opportunity to create decisions, everything remains until we say it doesn't, right?
Yes.
Okay. I think those are the two clarifications I appreciate. Thank you.
You're welcome. Okay, back to Marlene then with the COVID-19 vaccine update.
I'm back. I was trying to look a few things when we were talking about you're too fast. So yes, but I was checking on the numbers about the vaccine, just to be like a little bit out of my normal order. But yes, on Monday, the state towards their 70% vaccination rate for eligible populations was at like 60, let me see here. 66.8, and now they're at, last night, around 7, it was 67.1% of the population, so they're even closer. than they were just on Monday. So we typically get like, once a week when we get all of our data, you get the spreadsheet that shows how many county vaccines on the alert system, how many from the feds, for our pharmacies and those kind of things. So my report for us is still the same figure because we don't have anything new. So we were at 62, let's see, 62.8 on Monday. We probably have made some movement since that time and maybe at 63 or higher, but I don't have the official report from the state to be able to share that with you. So obviously on next Monday, we'll have more current data than that. Let's hope we're even over 63%. And obviously those same restrictions, if we are able to lift our restrictions before the state, I don't know timing wise how feasible that would be just because of when they have to review our data, but we'd have to be prepared to respond to the very questions that you're asking too. So just on our risk level, I think most folks know we're staying at the lower risk level through the next period, and then they'll review it again in the next, the next week period. So that's through June 11 through 17. And then they'll be looking at things again through the weekend of the 19th to see what our numbers look like. We had good to see that our numbers are decreasing slightly. So we had 9 new confirmed positive and presumptive cases. We had 10 the previous period. So it's good to see that we're staying low. Total getting close to 700 cases in Tillamook County, and unfortunately 4 deaths. So we're hoping that we can continue to stay and keep those numbers down. Just a reminder around that interim guidance in low risk. So that's for certain indoor businesses, employers, faith institutions. OHA released guidance that provides those businesses with a choice. So they can have a policy in place to verify vaccination history to relax their mask mandates for fully vaccinated people. So that's still in place, or they can opt to keep those mask mandates for all in place so they don't have to check things. That might be why people see things a little bit different business to business. There's still that guidance out there on the OHA website or the governor's office website, and we have links on our page for people that are interested. I know it's difficult to stay on top of this stuff for everyone, and with this upcoming change, we'll try to be as much anticipatory as we can. I already mentioned about the vaccination rates, vaccination sites we talked about on Monday, and I can reiterate those again now and at 10 o'clock. So for the month of June, we still have and will continue to have vaccination appointments available through the health center and health department at our 8th Street Annex, which is just right next door to the main clinic, not at the fairgrounds. So this is for new vaccines that people are looking or seeking them, can walk in or call to schedule an appointment. So that's Pfizer and Johnson & Johnson on Tuesdays and Moderna and Johnson & Johnson on Thursdays. Reminder that Pfizer is authorized for those 12 years of age and older, Moderna and Johnson & Johnson for those 18 years and older. Again, just remember and call us if people have questions at our 842-3914. So people are also asking and calling, what about my boosters? So if you receive those calls, the people that have already received their first dose and are looking for their second, that we call the booster, they will still be held at the fairgrounds for people that received their first dose at the fairgrounds. So if you were there to begin with, we're gonna do your second dose there also. You don't need to call, you don't need to reschedule. If you have issues, give us a call and we'll work with you to make sure people can get their second dose. So if you're not able, if we're not able to get to an appointment on Tuesday or Thursday, there's some other opportunities coming up, and hopefully you've seen them posted on Facebook or on our page or on the radio. So June 9th, the Creamery is hosting a drive-through vaccine clinic with free ice cream as an incentive. So you can have a yummy treat while you're waiting for your 15-minute waiting period, and you get some coupons too. The health center is also doing a summer COVID kickoff on the 19th of June from 10 to 4. All vaccines will be available. You don't need an appointment, just come on in. And just by way of a reminder, I know we've all talked about this. It feels like a long time, but it's probably been a couple weeks. If you are concerned, you want to talk to your healthcare provider or other trusted healthcare professional, do so, and you can receive your vaccine through your healthcare provider. Or you can go to the local pharmacies, Fred Meyer Safeway and Toledo Pharmacy to receive a vaccine. So there's lots of opportunities and ways to do that. And by way of a reminder, we were talking about it this morning, if we reach that 70% first dose vaccination rate or the 65 for Tillamook, then we can lift those restrictions and stay at the low risk category. So what we're talking about is, well, what does that mean? But in a broad sense, it includes masks, physical distancing, capacity limits requirements in almost all settings, and there are some exceptions following that federal guidance. So it includes things we mentioned too, airports, public transit, health care settings, I believe senior and congregate care settings, and it says vaccine verification will not be necessary. So there's likely going to be more updates in the guidance. There's also an update in the travel guidance for Oregon. So I'll send that on to you as well. So if people have questions or concerns, they can continue to call us or go to our tillamookcht.org, and we'll get back to folks and return calls or accept the calls when they come in too. Monday through Friday, English and Spanish. And I think I covered most of the things we talked about, and I do have my notes about sending the guidance for quarantine now travel, and variants was also a question, so I was sending that out to staff while we were talking. They are doing booster doses today, so the number of variants reported that I have, it's available on the publictableau.com site at OHA, but just region data that we can see in the variant reports. Region 1, that's us. So Plaza, Clackamas, Columbia, Multnomah, Tillamook, and Washington counties. So there are, the variants of concern are, they're just numbers and letters. So there are 1, 2, 3, 4, 5 of them. And these are the ones that fall in the category of concern. So B117, we have 174 of those in that region. B1.351, we have 42. B1.427, we have 52. Variant B1429, we have 224. And P1, we have 56. There are 1, 2, 3, 4, 5, 6, 7, 8 other variants of interest that have roughly 11 or less cases in the region. So that was just my quickly trying to see what we had for a report. I don't have anything specific for Tillamook County. And I think that's it, but happy to answer questions as always.
Thank you, Marlene. Do we have more questions for Marlene?
No, I think just the comment that I think we touched on it earlier, that the pandemic is still happening, and for those who are unvaccinated, the risk remains the same as it has been all along. So it's not that we're seeing this risk drop off drastically due to the vaccinated people. If you're unvaccinated, there is still a risk, and so just that awareness piece.
Thank you.
Yeah, and as far as I know, I mean, we're seeing a higher rate of hospitalizations across the country for younger people. I don't know the numbers for our region or county for the younger people, but it is, if you have the vaccine, you're protected. It appears to be, even though that there are people who may experience or have a breakthroughs, they might be minor symptoms. So I'll see if I can gather more information on that as well.
Thank you, Marlene. I think Bill has a question.
Thank Marlene.
Yeah.
I expected that the folks at my age level would tend to be set in their ways and say, I'm not gonna go get one of those shots for anything. And anecdotally, I think most of the elderly folks that I've interacted with have had their vaccinations. Am I right? Did the more vulnerable elderly, group tend to get theirs? Have you got numbers on that? And this is really personal because I had a classmate who, passed away from COVID. So, it's a real thing. So anyway, I just kind of wondered if there was any data on that.
Yeah, there is. I don't have it right here in front of me, but I can kind of do some anecdotal information for you. So definitely people who are in the 80+ category, I mean, we were close to 98% of people for Tillamook County receiving the vaccine. I think then for the next age group, 70 to 80, it was also very high, close to 90%. And also even for 65 to 65 plus, we had a very high percent. And I think for 70 plus, we were like the highest second vaccination rate in the state. So we do have a lot of people who are taking it seriously, a lot of partners who are doing extra outreach to ensure that people that couldn't travel, who were homebound, could receive the vaccine and actually went to their homes and are continuing to do so as people express need and interest.
Yeah.
So yes.
Then on the other end of the spectrum, my two eligible teenage grandchildren got their shots, and I sort of wondered, whether they would or not because of the, the information is they're not likely, or at least not as likely as their granddad is to pass away from it. But so at least anecdotally, I know in my own family, there's, they're going down some of the teenagers to get shots too. And I'm personally thankful for that, being in the vulnerable population, and they go to school where, it's got to be a hotbed for, virus and everything else. So anyway, I'm hopeful and I'm encouraged by my own family that they've thought ahead enough and think it's important enough to them, even though I don't think are as at risk to go get their shots as well. So anyway, thank you, Mark.
Yeah, thank you for sharing your personal experience. I appreciate it.
And I'd like to follow up on that also. I just learned last night that my grandson, 13 years old, has received his shot. My granddaughter, 11 years old, of course, is not eligible yet. But
Right.
it just points to the fact that these are personal decisions, but these aren't decisions to be taken lightly. These are important decisions. But again, this is a personal decision, but I would encourage everyone to get their shot. That's just going to protect more and more people. That's absolutely the case. But at the same time, if you have issues and don't want it, then I don't think there's anyone that's going to force you to do that. So.
Yeah, I would agree. We're not forcing people in our country, but we would certainly like to get to true herd immunity where the virus dies out and we don't have to deal with it every year with boosters or that sort of thing. And the 70% is not herd immunity. And I think that's important. We've chosen 70% because it does create a level of safety for those who are vaccinated, and we've gotten enough vaccinated that, it's not going to be as prevalent, not going to shut down as many workplaces or those sorts of things, but it isn't herd immunity. It will still be there. So we just really encourage everyone, even if you think for yourself, I don't feel like I'm at high risk. So it's not that I'm against it, I just don't think I'm at high risk. Please get the vaccine for those who are at high risk, and that's continues to be my cry. Get it for those who are at high risk. Help us get to herd immunity so we can really honestly put it all the way behind us. But agreed, no one's going to make you, and we definitely encourage you if you have questions, as Marlene said, talk to your healthcare provider. You trust them with the rest of your health. Trust them with this too, and find out if it's right for you.
All right. Well, thank you, everyone. and with that, we will move on to item 5, which is also Marlene's, discussion and consideration of a personnel requisition for a replacement regular full-time medical billing technician in the Health and Human Services Department. Marlene?
Yes, we have had one of our great billing staff take a new opportunity, and it's a critical position because we only have a couple of billing people in our department. We do have contracted billing services to assist our team, so we're not gonna stop billing or anything like that, but it's a pivotal position, and we're really gonna miss her, so we would like to fill it as soon as possible. Obviously, it's budgeted and it wasn't anticipated that she'd leave, so, yeah.
All right, thank you.
Perfect. Nope, I'm perfectly good with it.
Okay. In consideration of a personnel requisition for a replacement regular full-time medical billing technician in the Health and Human Services Department, I move approval.
And I would second.
We have a motion and a second. Any further discussion? Hearing none, I'll call for the vote. Those in favor signify by saying aye.
Aye.
Aye. Motion passes. Thank you, Marlene.
Thank you very much. Have a good day.
You too. Okay, the next several items are under Sheriff Kelly. Item 6 is discussion and consideration of a personnel requisition for a replacement regular full-time corrections deputy in the sheriff's office.
Yes, we had one of our sergeants decided to take a job in Portland, getting out of law enforcement duty. So this is a position just to replace his position. Everybody knows we are understaffed, and I can just go back up.
Okay?
That's perfect. Again, I'm in full agreement here.
Likewise.
Absolutely.
Okay, we're ready for a motion.
In consideration of a personnel requisition for a replacement regular full-time corrections deputy in the sheriff's office, I move approval.
I would second.
We have a motion and a second. Any further discussion? Hearing none, I'll call for the vote. Those in favor signify by saying aye.
Aye.
Motion passes. Okay, item 7, discussion concerning an intergovernmental agreement with the City of Rockaway Beach and Tillamook County Sheriff's Office for law enforcement services.
Yes, City of Rockaway came to us a couple months ago. There's significant personnel issues with their police department and essentially dissolving. And they've approached us to contract to provide law enforcement services for the City of Rockaway. This is a really big deal, and I think it, in the long run, will be a really good thing for the county and for the City of Rockaway. I'm looking forward to the challenge of it. And they're requesting to contract for 4 deputies who will control the city of Rockaway all year long, similar to what we do in Uvalde right now with only one. It will be challenging to get staffing level up there, but anything that's good never comes without a challenge. So it'll be difficult to get there, but I think it will be really good for the county and Rockaway in the long run.
Thank you, Matt. I agree with you. This is a good thing for the sheriff's office. It's a good thing for the city of Rockaway. In the interim, short term, it's gonna be challenging. It will be challenging as you try to staff up to meet that requirement as well as handle the huge hordes of people that come here in the summertime, et cetera. I feel for you, I really do, but if anybody can do it, I know the sheriff's office is up to the challenge. So I appreciate very much all the work you put into putting this IGA together. Very challenging. There's a lot to this, it really is. But I think we're in a good spot now, and I'm ready for it. I am.
I appreciate your perspective of the challenge being a good thing, because I do think this will be a challenge. I think it's important for people to understand that while you are moving to 4 deputies in Rockaway, it will start with 1 and will be added to as the hiring happens. Is that correct?
The beginning, we're gonna get 2, and
Okay.
it's going to be, I'm gonna be moving a lot of chess pieces to get to, I mean, Rockaway is, it's the worst time of year to start this,
Sure.
because their busy time starts now.
Right.
But, so it needs to be 2. But I have plans and I have people that are in the hiring process. I think I can get there, but like I said, it we'll get her done. I'm convinced of.
Perfect. I think it's also important for people listening to understand that if Rockaway dissolved their police department and it did not contract with us, we would by default end up having to handle things that come up in Rockaway. And so this allows us to actually partner with the city of Rockaway, have a proactive stance in keeping Rockaway safe, and have that financial contribution from the city of Rockaway to make that happen. So I think if someone listening is thinking, why are we taking this on? It's because we would have otherwise had to respond to serious and significant issues there anyway. This allows us to be proactive and to keep the community safe and not have those serious incidents with us, not being on site regularly. So I think it's a good strategy. I think as we look around at small cities that struggle to keep police departments going, and understandably so, the model that you have already developed with Garibaldi puts us in a great position to do it. So yeah, I think it is a good thing, and again, appreciate your perspective on challenge.
I support it also, and I think it's a good opportunity for the cities, Rockaway and Garibaldi, to be involved in the IGA, to be able to come to the table and say what they want and what they hope for. Because if they just dissolved the police department, you would, as Commissioner Scar said, respond to the calls, but they wouldn't be involved in the services that they're asking for. So I think this is a great solution. And in terms of the process, I just wanted to mention that last week we had several versions of the contract floating around, and so it was postponed. It was on the agenda, it was postponed, I'm sure you know. And so I just wanted to mention that how the process, I felt badly that it was postponed and we weren't ready for it. How the process will work best is if you send a PDF to Rachel and Joel, and then Rachel and Joel have to approve it before it comes to us. So that process would work best, and I hope to avoid future delays. Okay, so we're going to vote on that at 10. And item 8 is discussion concerning an intergovernmental agreement with the City of Rockaway Beach for court services.
Yes, it's just a tag on to along that. Most small cities that have their own police department historically have had their own muni court, municipal court. And as it kind of just falls in line to contract with, or to go use our justice court. Potomac City did it a few years ago. Similar back when we started with Garibaldi, they did all their muni court and contracted or did an IGA through the county through justice court. And it just makes everything flow better, and it relieves some costs for that city. Then we have our deputies who are citing into different courts in different cities, and that can get through a lot of moving pieces where things can get mistake.
Always the case. So I take it, we've had conversations with Judge Cannell, and he's ready for this, raring and ready to go?
I wouldn't say that, but he's on the phone.
Oh, he's on the phone.
Judge Cannell, would you like to speak to this issue?
Hi everyone. Ultimately, this is a jurisdictional issue. I don't really get involved in jurisdiction. That's a legislative function. And, every time we have a budget meeting, I always say that the Justice Court's going to be asked to do more work for the same amount of money, and that's been pretty clear that's coming, and that's totally fine. As for being ready for it, we've been over the last couple of years really focusing on maximizing efficiencies, and so ultimately this is going to be a drop in the bucket. We're here and we're ready to go. We're doing it for Tillamook, Garibaldi, and Bay City right now. So it's just another city that we can take over for. Won't be a problem.
Perfect.
Thank you, Judge. Okay, do we have any other questions about this? All right, well, thank you very much.
Yeah. Will you be here at 10?
I will be here.
Perfect, thank you.
Okay. Item 9 is Lieutenant Seaholm. Discussion concerning a professional services agreement with Roger Cook, PhD, LPC, for sex offender assessment and counseling services. Good morning, Lieutenant.
Good morning. So professional services agreement between us and Dr. Roger Cook. Dr. Roger Cook currently offers our sex offender treatment for any of the offenders we supervise that have requirements either set forth by the court or the parole board or through general conditions that are required to participate and complete a program. Something we've been discussing and working on for quite a while now, and it's kind of had some delays, is trying to find a way to pay for those services up front and then have the offenders pay us back. Right now, it's not something that insurance can be billed for, so the offenders that are participating in these treatment groups have to pay out-of-pocket costs, and sometimes that can be a barrier because it can be quite an expense. Dr. Cook's always worked really well with the offenders, but it can be a barrier to get somebody started in these services. So removing that barrier up front, but also holding the offender accountable for actually paying for these services, and then they would be billed back and pay us when they can, would ensure more of a participation and get them quicklier involved with the services that they need to be doing. So Dr. Cook has agreed to do this, continue the services. He eventually wants to retire, so we'll have to be finding somebody new. But with COVID and everything, he's been working with the guidelines, and also during our moving risk levels, if we've had to not have group, he's been doing one-on-ones via phone and has been really flexible with helping continue with the program. So.
Perfect. This is an important part of treatment and assessment. It is. It's something we don't like to think about, but something that needs to happen, so, I appreciate your work here very much.
Yeah, I am in agreement. Our ultimate goal is not to have sex offenders reoffend, and this sort of treatment is a critical piece of that. And so the more available we can make it for people, the better off they are and our community is. So I appreciate this, and I think it's a great approach.
Likewise. So we will vote on this at 10. Will you be with us? And could Under Sheriff Kelly carry it for you? You guys were.
And I should say too, if I may, I think an important piece is that, we don't want the financial end of things being a barrier to somebody being untreated.
Absolutely.
With an offense of this nature. So
I agree.
it's
Yeah.
an important piece of it. So.
Yeah,
That's great.
absolutely.
Thank you.
Absolutely.
So,
Okay, so we'll see you at 10. Thank you. All right, item 10 is postponed. The next couple of items are Gordon McCraw, Director of Emergency Management. Item 11 is discussion concerning an Oregon Office of Emergency Management fiscal year 2021 to 2022 emergency management performance grant application. Good morning, Gordon.
Good morning again, and I want to take the opportunity with all the vaccine stuff that I've gotten an email from down south. It says the Stucco Rural Fire Protection District in the South County Emergency Volunteer Corps will be holding a Johnson & Johnson walk-in vaccine clinic on this Friday, the June the 11th, from 12:30 to 5:30 at the Evo Fire Station. So just another example of our great partners and great volunteers doing great things for the cause in Tillamook County. As far as the grant goes, this is an annual event, Emergency Management Performance Grant. It's effective from June 1st of this year until, make that July 1st of this year until June 30th of next year. In years past, I've also had a work plan completed. OEM was a little slow this year. I'm sure between COVID and fires and all the other disasters, they're behind the timeline, but I'll be getting information on how to complete the work plan. This is just the cover sheet that tells us how much we're applying for and that we intend to apply for it. It's a 50-50 grant. It pays salaries only, so for the new commissioner's information, the 71,790 times 2 equals obviously more than what I make. So what we do is we charge OEM for one full-time FTE and one .25 FTE, and the .25 ends up getting reduced so that the total amount that we are eligible for, we can use, if that's not too confusing. Again, it's just an annual thing, and it pays half the salaries.
All right, thank you, Gordon.
Thank you, Gordon.
Do we have any questions about that? No. All right, we'll move that forward to 10 o'clock. And item 12 is yours also, Gordon, the Nixle system update.
Yeah, I wanted to clarify things because previously I'd said that, as if you recall, that Everbridge is now free to the county, and that would include Nixle because they own Nixle as well. Well, it always sounds better than it actually turns out being. So, Nixle is a separate part of Everbridge, and what they were trying to do is to match the functionality that Nixle has. And so I think that it's in our best interest to continue to use Nixle in the manner that we have been. Otherwise, we will actually lose some functionality at this point anyway in it. Right now we have in Nixle 12,223 users, which impressed even Everbridge as to the number of people that are using Nixle in the county. And we're also going to be adding, we've already added some ham, some CERT, and we'll be adding other Emergency Volunteer Corps members to the list so that we could use Nixle to activate those people as needed through this Nixle system. Some of the functionalities that we would lose is some of the social media features. Right now, if I punch something into Nixle, it automatically gets fed to social media sites. And then moving the special groups over from Nixle to Everbridge would present a little bit of a problem. So I just wanted to make you aware that at least I would hope that you would agree that I should continue to use Nixle in its current format, which means we would still pay I think it's about $3,200 a year for everything that I get with Nixle.
Thank you. Well, I do agree with that. I think Nixle is really valuable to our community.
Yeah, I agree. It seems a small cost for the information we're able to push out, so.
And I concur. Thank you, Gordon.
Thank you.
Okay. So the next item is Chris Lady, discussion and consideration of a personnel requisition for a replacement regular full-time road maintenance equipment operator, journey level in the Public Works Department. Good morning, Chris.
Good morning, Commissioners. We have a position, an MEO3 position, a higher position. That gentleman will be retiring. We do have an internal process where we're going to likely promote an individual from an existing MEO2 position to an MEO3 position. This new position is to replace that person who will be promoted. So in reality, we're essentially replacing a person that is going to retire.
Okay.
So it's an existing position we're intending to replace due to retirement.
Okay.
Hey, Chris, I just need to tell you, you need to look out that corner in front of you. Looks like it's a little wet, so be careful going around that corner, would you?
Name the road.
I could not.
Wilson River Loop.
Wilson River Loop.
Is it really?
Yeah. Yes. I think the greenhouse is just off to the left
Yeah.
that has now fortified itself with big rocks and all of that. Been there, stopped for that.
I love it, yeah. there you
Decided
go.
not to go there.
Yeah, yeah. Don't drive through it.
Don't drive through floodwaters. Not that that's the highest thought on our mind right now. Okay, so we
And I'm sorry to interrupt, but I'm in full support of this position.
As am I, and I'm glad you're able to promote somebody from within to the MEO3, so I think that's great.
Absolutely. Appreciate promotions when we can do that.
Okay, we're ready for a motion.
In consideration of a personnel requisition for a replacement regular full-time road maintenance equipment operator, journey level in the Public Works Department, I move approval.
And I would second.
Motion and a second. Any further discussion? Hearing none, I'll call for the vote. Those in favor signify by saying aye.
Aye.
Motion passes. Thank you, Chris. The next item is with Dave McCall, Solid Waste Program Manager. Item 14, discussion and consideration of a personnel requisition for a new regular full-time solid waste transportation supervisor in the solid waste department.
And I have this one as well.
Okay?
So this is a new position that is intended to manage the Manzanita transfer station. When we took over operations, we really didn't know what the impacts would be. This is a new position for that, to help manage that and minimize David McCall's workload. It is budgeted for the next fiscal year, and this would allow David McCall to actually do what his job is required to do. So it instead of doing double, triple duty, he'll only do single or double duty. It is budgeted for the next fiscal year.
Thank you. Well, as liaison to solid waste and also a North County community member, I can attest to how busy that facility is, and that the fact that very often when I go there with my own recycling on the weekends, Dave McCall is working. So I completely support getting this fully staffed up.
So this is in the budget for next year, next fiscal year?
Correct.
Okay, all right. I was under the
Looking to
impression-
advertise now simply because it takes a while to actually fill the position.
So I would, and since Sean, I see Sean popped up here, so Sean, I also understand that we're under a hiring freeze?
It's still, I believe in our COVID policy that we're under a hiring freeze, but we've been under a hiring freeze for over a year, and it hasn't seemed to stop departments from hiring if they can find those people to fill those positions.
I think to add to that, solid waste, Manzanita in particular, is seeing record numbers of recycled materials, record numbers of solid waste, municipal solid waste at that facility. As people under COVID, they're cleaning house, they did clean house, we're seeing a lot of second homeowners. The vacation rental business is doing quite well. All of that is generating more trash than Manzanita has ever seen in the past, under Public Works, under Tillamook County's management.
And I can agree with that, seeing the revenues that have been brought in over the last year from Manzanita Transfer Station.
And it's not that I disagree with the need for this person, I don't. Excuse me, I do agree with the reason for this person. I'm a little concerned about possible repercussions, but I will support this.
I think we're ready for a motion.
Okay. In consideration of a personnel requisition for a new regular full-time solid waste transfer station supervisor in the solid waste department, I move approval.
And I would second.
We have a motion and a second. Any further discussion? Hearing none, I'll call for the vote. Those in favor signify by saying aye.
Aye.
Motion passes. Thank you, Chris.
Thank you.
Item 15 is mine. It's discussion concerning an order in the matter of the appointment of a member to the Tillamook County Fair Board. And as the liaison to the fair, I can say that Sarah Christensen is qualified and willing to be appointed to the Tillamook County Fair Board. She's been a fair volunteer. She has attended at least one, our last fair board meeting. The board and the fair director are all unanimous in their support of Sarah on the fair board, as am I.
I mean, the Fair Board does absolutely amazing work in Tillamook County. I mean, it's more than just a volunteer board. They do so much physical work on the fairgrounds to make sure that it's ready. It's my understanding we're gonna have something very close to a full fair this year. So I'm sure there's a lot that needs to be done out there. But again, kudos to the fair, your liaison, Commissioner Bell, and the fair board members in particular. Our fair is recognized across the state as absolutely one of the best fairs to attend. So I'm in full support of this.
Thank you.
Yeah, I absolutely agree. We have an amazing fair. Over this last weekend, we went to my nephew's graduation at the Wasco County Fairgrounds. And my daughter, who's 16, said, you know, I remember coming to this fair, they had like 3 rides, you know, and she's like, this is, and the county, Wasco County population is very similar to the Tillamook County population. So Tillamook County does an amazing job, and we have made the fair a showpiece for our county, and you are correct that the Fair Board does a ton of work, and of course, Cammie Von Segern is their tireless leader, so we couldn't do it without her and the Fair Board, so I'm definitely in support. Let's
Terrific. We'll move that forward to 10. So, do we have any board concerns at this time?
Commissioner Bell,
Yep.
this is Cammie Von Segrin.
Hi, Cammie.
Hi, good morning, everyone.
Good
morning.
morning.
I did just want to speak just briefly in regards to Sarah, and I will not be able to attend the 10 o'clock,
Okay.
so I appreciate the opportunity. I just wanted to let you know that, yes, Sarah is from a dairy family. She also is a vet tech, so she's very familiar with animals of all types and breeds. She is already volunteering to do projects for this year's fair, whether she would have been accepted or not, and has taken on one entire project. So what I see in Sarah is her willingness to jump in and do whatever needs to be done. She also can drive a skid steer and a tractor, so that is very important as well.
I can drive a tractor.
She is a very well-rounded individual and just a delight. She is going to be a breath of fresh air on the Fair Board, so I appreciate your acceptance of her position.
Thank you so much, Cammie.
Yes, thank you, Cammie.
All right, we'll move that forward to 10 o'clock. And do we have any public comments, Isabel? All right, hearing none, we will adjourn this meeting at 9:43.